So good morning, everyone. I'm sure that more people will arrive as time goes by. Traffic outside is a nightmare, but we also have a problem with the parking. So I believe that later on we will have more people in the room. Today we are here in order to discuss about a rather difficult problem. And in the context of this panel, we are going to talk about possible solutions to that problem. But in order to reach solutions, we need to reach the level of AI and maybe even exceed the dynamics of AI. You, Mr. Kontogeorgis, who are the keynote speaker, will also refer to this framework agreement that needs to be completed soon in order to solve the issue of pharmaceutical expenditure. On the one hand, we have approximately 2.5 billion euros expenditure on an annual basis. On the other hand, we have real needs that are much more costly compared to this amount. The real amount that the Greek people needs in order to have their needs met is more than 2.5 billion, double actually. So how can we possibly bridge this gap? I don't know if AI is enough. We need money, of course, and we need something smarter and more effective. I would say that what we need is a different model. But, Minister, if you could please take the floor, and then we will have 2 rounds of interventions. We are going to give the floor to the panelists who will comment on what the Minister has said, and then they will answer to some more difficult questions that I will put to them.
Good morning, everyone. Now from Mr. Christopoulos' introduction, whom I would like to thank for the invitation, as well as the AmCham. I believe that the expectations are high. I don't know whether this period things will happen that didn't the past 100 years, but to link things with what Mr. Fourlis said before I go to what I have prepared for you today, and since he did refer to AI, we are at a time when several decisions that have to do with Europe and Greece will affect the landscape in innovation and the industry alike for the various several years. But I would like to ask you to devote some time, because some of you have already done that, the report of Super Mario Draghi, on European economy and competitiveness, and in particular the chapter that has to do with innovation and to what extent AI can be that factor that will give the opportunity to Europe to regain the first step, as it were, in innovation. But it also set those limitations that pertain to the Greek case and Greek economy. What are those? Well, it's the fact that we're lagging behind, digitally speaking. The fact that the new market hasn't worked in the European environment in its entirety, so this has not favored the growth of businesses that has to do with the Greek case. And, of course, the fact that to a great extent there is an over-regulation in various issues, which hinders various new businesses and good businesses enter into the economic cycle. Surely today's topic pertains to politics, to reform, to the need, like Mr. Christopoulos said, to change things that have been bothering us for years, and structural reforms and delays and everything. But this reform is meeting the personal experience, the experiential life and knowledge of everyone with a health system that was created to offer equitable access to all. And this is something we should always remember. The national health system shielded health and all its aspects for a society that claims its prosperity on the basis of equality. And let's remember that we should not take this for granted, especially during the pandemic, not just in our country. This was threatened. But the ESI, the national health system, was a barrier, as it were. It was a It was a wave breaker that helped us prepare the country and protect the country with the vaccination program and everything to allow us to exit this crisis with an impact that could have been catalytic for society, for the economy, and for the weaker, the more vulnerable ones, because this is where interest lies. As you know, we set as our priority the enhancement of funding the national health system. As of 2019, we have an increase from 3.8 billion to 5.8 billion of the GDP in order to be able to plan and design policies. But this increase in and of itself is not enough. We need rationalization and reduction of expenditure. It is a system that is under stress and tired. We're trying to have the best possible digitization despite the delays. You know, we do have funding from the RRF, so we need to be on time. In a temporal prediction that favored the urban centers, and we place emphasis on in the region and the remote areas. And the lacking control of the economics and the finances of the national health system, we have protocols that enhance saving. And of course, the management of disease or trauma, we prioritize prevention. And in this tug-of-war we have between the public and the private sector in health as well, we promote the partnerships, which we exhibited during the pandemic, and these are the ones we'll be talking about. Besides, the government has been trying to resolve structural problems to ensure and secure sustainability overall, with a free economy but without squandering public money, with early prevention of disease and filtering of patients in primary healthcare, and so on and so forth. As you very well know, the big horizontal programs are in progress. Building upgrade, digital upgrade, which must have a preparedness to be able to incorporate the utilization and exploitation of data as well as AI, as was mentioned earlier. The support of the human resources, both in terms of amounts of money and in numbers. For 2024, the Minister mentioned a few things that seem encouraging. Some first results we have as compared to what we have been implementing. The first buildings are being delivered, which were built on RRF funds. This will be completed by August 2026. We have the largest number of performed surgical operations and an increase as of last year. And as you know, the afternoon hours with the participation of the Ministry of Health completed a negotiation with the European Commission in order for 51 million euros to be allocated from the RRF for free afternoon ORs, operations, to clear the backlog for people who cannot. And the people who haven't gone to surgeries are the ones who do not have another recourse, cannot result elsewhere. We closed budgets from the 10th of January. We have positive results. This is a process that we've undertaken for the first time. We are on target, and we're doing better than targets at the 8-month mark. And I think that in the 9-month mark we'll do even better. You know things about Ithika, as well as for the pharmaceutical expenditure with the AOP and the transparency required, and of course the shortcomings and the lackings in the drugs and the increases in drug prices that had to be performed for specific reasons. We have the Doxiadis plan, which is operational, the RRF. Well, you know, there is a legislative priority and initiative to enhance personal doctors, and these were analyzed yesterday. I will insist rather a bit more on the economics and finances, for which we still have some issues pending. And of course, some others, and you are people who've been working on these things for years, that come from the past. Several, of course, prepare for the future and have to do with the future. As you very well know, an interministerial committee was established with the participation of the Ministry of Health, the Ministry of Finance, and the Prime Minister's office. And there we set up a monitoring with specific landmarks in policies that have to do with structural interventions and curtailing, controlling expenditure. Now, we have the presidency of the government, the department, the Ministry of Development, due to the potential clawback, will be the institutional interlocutors with the market from now on for the joint issues, for the issues that have to do with health and primarily financial issues. The 4 axes of pharmaceutical were pharma, hospitals, health providers and some horizontal policies that require the coordination of ministries and facilitate, like the uninsured, active or inactive, SSN, etc., Social Security number. Now, we have a rational increase of the budget for pharmaceutical expense and curtailing squandering, which will allow us to remove or rather reduce the refunds we impose on the market. The target is to create the fiscal space to rationalize and streamline pharmaceutical expense, the purchase of drugs to the benefit of citizens, innovation and investment. This is implemented by safeguarding, I would call it, an increase of budgets and some changes in the EKP, centralization of procurements, controlled prescription, and so on and so forth. Apart from the improvement and optimization of pharmaceutical policy and transparency, the government places great emphasis in securing access of patients to the necessary treatments, and of course the promotion of innovation. We have the evaluation committee. In public hospitals, the EKP order reception system, you know that, the control with KPIs, measurable KPIs, the implementation of DRGs, and of course the rebate system with any objections that there may be, and of course management of arrears. In conclusion, I should like to say that our program is focused on a more general control and curtailing of expenditure and reduction of clawback for the benefit of 300 million or such, and continuation of the funding of the investment clawback. Same as this year, we have the process between the co-competent ministers for the issuance of the joint ministerial decision. We have the same thing for the next years, and in the same logic we have the RRF plans and projects that are financing clinical trials, R&D studies, and of course the MP fund that with 200 million can in fact finance and fund investments on innovation in the field of sector. Regarding the consultation with the market, I believe that the reduction of pharmaceutical expenditure that we see here does send a positive message, and the government wants to agree with the industry on a stable environment within which reliable decisions will be made. We believe that if the country builds trust, and we have recovered trust to a level that has to do with our fiscal matters, we need to do the same on the more specific sectors. We will gain investments, and indeed we want to improve and import innovative treatments. And we're concerned at the central level the management and utilization of data as a whole. As you very well know, and it was mentioned yesterday, I think we recognize and acknowledge a memorandum of understanding, and I think in the immediate future we'll have more to say after meetings that will integrate and complete this process, similar to what has happened to other countries like Portugal, Belgium, and others, that will set in a long-term plan what the commitment is on behalf of the Greek state for the policy it wants to implement, and what are the commitments of the Greek state for the actual funding of the system. The medium term, the new medium term, defines the capabilities, which may of course guarantee the things that it will have, and what on the other hand will be the commitment on the part of the industry regarding the responsibility they will undertake. It will be a roadmap that will be characterized by transparency and stability.
While we're waiting the Minister to take his seat, I would like to make the introductions. We have Mr. Angelis, Secretary General for Strategic Planning, Ministry of Health, Ms. Labrina Barmpetaki, President of Pharmaceutical Companies Committee at the American-Hellenic Chamber of Commerce. I'm not going to give you all her capacities because there are many. Elena Chouliara, Vice President and responsible for reimbursement, but also responsible for the negotiation in the Hellenic Association of Pharmaceutical Industries. And Theodore Tryfon, President of the Panhellenic Union of Pharmaceutical Industries. You know one another, I'm sure for that. And I'm not surprised when I hear Mr. Kontogeorgis saying that increasing funding is a priority of the government. It has tried to increase funding and it continues to do so. And this actually leads me to the following question, Ms. Barmpetaki. After the RRF, what? I cannot ask this question as a journalist because I know that funding is currently increasing, which means that we found resources that didn't exist in the past. But the point is that these resources will not exist forever. So how are you going to replace them? I understand that the framework agreement is important, and I would like you to tell me how far you think that it will last and what will it entail? Is it an integrated model, as I imagine it, that includes all the steps starting from the identification of needs, the treatment, the importation of treatments, the cost, the financial resources, the shortage of financial resources, or is it simply a political framework agreement? In other words, it is an agreement on the basis of different principles that constitutes the basis of further discussions. So good morning. I would like to thank the AmCham for the invitation. And I would like to start with the first question, which was whether we are aiming at having whether we are planning to continue increasing the funding. Yes, of course, this is the answer. And the Prime Minister has said that we will continue increasing the funding in the system. We had 320 million entering the system for 2024. The Minister beautifully described that the goal of the system is to have extra funding on the one hand and on the other to reduce squandering in order to improve the effectiveness. The immediate goal in the health system are, first of all, timely and equal access to new effective treatments. But of course, we know that this has two sides, the side of offer and the side of demand. So it is a wider policy that we implement in order to correct the existing distortions. Now, with this agreement, some people call it a framework agreement, others memorandum of understanding. What we are trying to do is actually to do what other countries have done in the past. This is basically an agreement between the state and the industry in the context of which they agree that in the coming 3-4 years, we will have this increase of funding. This amount of money will enter the system, for example. That is why it's very important to have around the table representatives of the Ministry of Finance, but also of Development, not just of the Ministry of Health, since this discussion pertains to commitments that need to be made by other ministries. So first and foremost, we need to have the Ministry of Finance. So what do these agreements do, these contracts or memorandum of understanding? Basically, they ensure predictability and stability because, okay, we know that we have underfunding problems. We know the amounts of clawbacks and rebates. But what the industries and the companies do not have is to know in advance what the year will bring. So they need the stability and the predictability so that they can know what will happen 2 years later, for example. And what is the timeline, do you believe? So let's talk about this memorandum of understanding. Since the government will last until 2027, the first memorandum of understanding will have a 3-year duration up to 2027. Maybe the next one will last 4 years, but the first one, on which we're going to agree with the industry, will have a 3-year horizon. So the most important pillar will be the funding pillar, which is very important for the industry, but there will be other pillars of equal importance. I'm not going to enter into details since it is a work in progress, but maybe it will have to do with the prioritization of the industry, the commitments made by the industry vis-à-vis the state, what is the commitment of the state for funding and investments. Last week, we had a meeting with SFEE, the Association of the Industry, and we expect SFEE to make an initial proposition on which we are going to build future plans. And this initial proposition that we are going to use, both us in collaboration with the other ministries, is important to include the entire industry, not just SFEE. SFEE, PIF, PEF, and SAFE. All the industry and the state to be around the same table and have the discussion about the same goals. So, okay, so I believe that the representation today is quite satisfactory since we represent most of these players that you mentioned. Ms. Barmpetaki, what are your initial thoughts? And at this point, I would like you to tell us whether there is something missing from this model, from this plan that Mr. Angelis just described, and whether you have anything to add, any ideas, anything that you believe is important to be included in the algorithm, since we're talking about AI as well. Okay, I don't know if you can hear me. Okay. We want to complete this discussion within 2024. And as Mr. Angelis aptly said, we want to sign this 3-year Memorandum of Understanding and Cooperation that will include all the different parties of the industry. I want to remind you that the discussion started before summer. It was then that we highlighted the need to have a Memorandum of Understanding. And then, very quickly, we worked with SFEE and PEF in order to reach this Memorandum of Understanding faster. We have a common objective, and we know that what unites us are more than what divides us. Now, on my part, what I would like to do is to share some initial thoughts and what we are about to see in the coming weeks. It is very important to say what actually makes countries, other countries, as the minister said, like Belgium, England, Portugal, what makes them build this framework agreement, this memorandum of cooperation. For me, the most important question is why? Why do we need such a memorandum? First of all, we need it because the resources are not infinite. We know that. And we also know that we have inherited this from the past, from the difficult years of the past, and that there is a gap between what resources are needed in the pharmaceutical market and what resources actually exist in order to support the access of patients to new treatments. We need to say this every time we can because it's important. At the same time, distortions pertaining to the distribution or the best use of resources have led us to the point that we currently are. Yes, uncontrolled rebates that have reached limits that are unbearable and even worse than unbearable, especially in the channels of innovation. And Mr. Angelis and the minister are aware of that. We are having discussions that 80 and 85% are not rebates that we can possibly accept since they do not allow for the import of new treatments. What was mentioned previously and was right was that we need to stop this hemorrhage and to enter a new chapter, a chapter where we will have predictability, sustainability, and certain principles that we will abide by, because we believe that this will be very important for us to ensure the harmonious regulation of the system. At the same time, we need to insist on the rational use of the resources. We're not talking about a market that can continue to develop in an inflationary way. No. So there are two sides. The funding on the one hand, and the demand on the other. Now, we have this opportunity. Why am I saying that? Because the government has 3 years ahead of it, and in collaboration with us, it needs to modernize the pharmaceutical market. And we believe that the Memorandum of Cooperation will help us reach this objective. But what else do we want to do? We want to place Greece in the map once again as a pole of attraction, of innovation, but also of scientific projects and of scientific studies and of investments. And why do we say that? Because other countries are moving ahead. So we need to remind people that Greece has turned the page, and that on the basis of that, we need to find incentives in order to further promote growth and innovation. We need innovation. We want treatment solutions for the patients, and we can actually increase our footprint in that sector more as an industry. So what do we want to achieve? Which are the results that we want to get? We want to have the necessary regulations and the needed funding, but also the right incentives and the commitment of the industry. We do not renege on this promise nor on this role, because this is the compass that we use in the context of all memoranda of understanding. And we do that first and foremost for the patients, because we want to guarantee that the patients in Greece, when there is an unmet treatment need, will find the right treatment at the right place and at the right time. And this is the way that are going to help the health system, but also our economy. Very briefly, in order to leave some time to the other panelists, I would like to say how PIF plans with specific technical chapters and details and objectives, this memorandum of cooperation. I mentioned goals and KPIs, and this is an answer to your question, Mr. Fourlis. We're not talking about some principles that need to govern this system. A memorandum of cooperation, in order to be operational and effective, needs to have goals. And thanks to the very important work that has been done by the government, and Mr. Kontogeorgis is the head of the Interministerial Committee, actually, can help us keep track of these goals and make the necessary corrections whenever they are necessary. So, the content of this memorandum, first of all, funding. Funding needs to be increased. We have a 3-year period in order to do that. And we also need to talk about the additional funding and about the right allocation of these resources so that we can actually leave some space for new treatments to arrive in Greece. So this is a very important first chapter, funding. At the same time, we have ideas and are going to submit them about the model, because we want to talk about the budget of 2025, 26, and 27. And at the same time, we want to make the most of measures that can save resources. And we want to measure the results of these measures and of these steps. So we need to identify the funds that are needed, the funds that will be saved, and at the end, what we commit to do as an industry. As Mr. Kontogeorgis said, it's not possible to talk about funding only. We need to talk about a health system that has the right structures. We believe, and this is a main proposal, and of course we're going to give more details in the future, that after having assessed the needs, after having the negotiations, having imported the treatments in the system and then the monitoring of the patients, we need to have a system that will ensure the communication of all these different parts. And we do have proposals to make with regard to that, because we believe that we can create the space that will allow the import of new treatments. This can be done with the right use of data, but also with actions like the ones that have already been taken, like the HTA and the therapeutic protocols. I'm not going to get into details. It's very important to remind that it's not funding without results. No, it is a funding that is measured and brings results. Third, incentives, tax incentives or investment incentives. This will allow the entire industry to find the space in order to leave a footprint. And this is why we need to have discussions with the Ministry of Development in order to identify these incentives. And the last chapter, which is our commitment for the timely import of treatments, but also commitment for the smooth operation of the market, like, for example, which is our contribution, which are the therapeutic solutions that we propose, which is the support of the patient and additional services. Because I want to remind you that we not import only drugs. The Ministry of Health has actually shown that we offer screening, patient monitoring, and diagnostics. Last but not least, something that I mentioned a little bit earlier, and I would like actually to hear what the Minister has to say about the monitoring mechanisms and the auditing mechanisms and the goals that we will try to reach. All these 5 chapters constitute a starting point for the discussion with the Ministry of Health, Economy and Development, along, of course, with the Prime Minister, so that we can reach a memorandum of agreement in the coming 3 years.
We see this in slides and in geometrical shapes. It's what you have in your minds, and this is a good base for discussion. Mrs. Chouliara, good morning, and thank you very much for the invitation. Now, as the SFEE, it is indeed, I'm very satisfied with the progress we have in this discussion. A discussion that has been ongoing for more than 10 years, ever since it first started. And at the time, it's more timely than ever, I should say, because the situation has reached a dangerous point. If I could have my slides. As I was saying, it has been an ongoing discussion, and the SFEE has already been, always been supporting the position that we need a national pharma policy in this country, which will secure and ensure sustainability to the benefit of the patients. So why do we say that this discussion is more timely than ever? Well, looking at the global trends, we can see that the conjuncture of aging populations, disease trends, innovation, and new solutions create an equation where we have increased needs for healthcare and exponential advances in life-extending therapies and technological advancements. Now, in these conditions, if we take a look at the position of Greece, that has been availing the lowest percentage of its GDP for health, we can understand that this mix is even more explosive. And if we talk about pharma, in particular drugs, we can see that the Greek state has a per capita spend on pharmaceuticals at approximately 60% of the EU average. So this combination leads us to this picture that we can see on the slide, where the total pharmaceutical expenditure has been increasing by a rate of 8% approximately. These growth rates are similar or the same with the pharma expenditure that we see in all advanced countries, but the difference with the Greek reality is that an increase is at around 8%, and the public pharmaceutical expenditure is increasing at a rate that is lower than 2% within the same period of time. And obviously this creates a funding gap that is covered to a great extent by the pharmaceutical industry, which in 2023 contributed to 50% of the overall cost for drugs that were consumed in Greece. Now, we need to see what happens here and what happens with the drugs, but unfortunately this is not the situation. Here we can see the statistics from a study that has been running by FPA in Europe every year, which highlights and promotes, it's the most recent publication this summer, because that in Greece in 2023, from 167 drugs that were approved, new drugs that were approved by EMA in the 2019-2022 4-year period, less than 50% were available, whereas full availability was for only 25% of them. Someone could say that this reflects delays in the process, but this is not exactly the case, because in a study carried out by IQVIA, as commissioned by SFEE, earlier this year, we saw exactly this worrying finding, that from innovative drugs that have circulated in Europe over the past 4 years, more than 50% will not be made available in Greece under these conditions, which is not positive for anyone, especially the patients. So how do we move on from here, and what are the next steps? As of 2019, Deloitte, with the support of the SFEE, performed a study that aimed at answering this question exactly. Where should a national policy on drugs be based? It should be based on co-responsibility, predictability, and will have specific actions and targets. Initiatives, rather. Here we have the 7 key pillars. First of all, we will need to reframe the pharmaceutical budgets. I think it's clear increases as per the GDP growth rate are not enough. The second is, of course, an increase in efficiency. Of course, there's a lot of opportunities and gaps in the system. There's a lot of things that we can do in order to ensure and secure that the funds are spent in the best possible way. The third has to do with a payback mechanism. We will need to review that. The fourth has to do with enhancing the access to innovative therapies. So we shouldn't be talking about only 50% of the new treatments being available to patients in Greece. The fifth pillar has to do with the promotion of investments. And of course, there is great room for promotion in order to allow our sector to contribute even further in the growth and development of the economy. So we would like to see how we can use the new technologies and the new tools provided by digitization to move forward. And the seventh pillar has to do with the promotion of social and ethical responsibility, which is clearly inextricably linked with the activity of all the people involved in pharma. Now, we believe in SFEE that any discussion or framework of agreement or pact or memorandum on a national pharma policy will have to be based on these 7 pillars and cover these axes. Right. Well, so here we have a second point of view, correct, on how we should build this model. And I would like to say that, well, it would be interesting with the Ministry of Development if you actually presented everything. Right. Good morning to everyone. Thank you very much for the invitation. And I think I have a presentation ready, don't I? Right. Well, what I would like to say is that I represent 45 productive units and some foreign companies. This is a very big ecosystem in the 400 factories of generics that exist in Europe. Second, Greek companies have a lot of innovation, research and development. And this is very positive, and we hope that we will collaborate a lot longer and a lot more with other companies abroad. Some generics companies, but even with the large multinationals at the level of clinical trials. We did an Academy of Clinical Trials with Bayer, but also to bring parts of innovation in Greece on the basis of the very powerful and strong diaspora scientific community we have. This is one first point we have there, so we have a very strong productive base. The second means that in the pandemic, Greek companies and foreign companies covered the Greek population. It should not go without saying, and it happened to a greater extent than other countries in the European Union. Foreign companies, because they prioritized Greece in terms of imports as compared to other countries where they had huge demand, and the Greek companies we have because we had a huge productive base. So it's during a crisis that you can see the issues and how people deal with them. I started with the pandemic to say this, that the pandemic was just a pretext. Those of us who were in business in Europe, and we in Greece experienced it more intensely, saw that the European model, regardless of the responsibilities of our country, to what extent had significant problems. I will also refer to the Draghi report because it has recorded great detailed things that need to be done, same as OLED, but I'm not very optimistic that these will happen, let alone fast. And I don't think that Germany, for instance, will be convinced to deal with this funding problem. But we have this. Europe now sets as its new targets in the post-pandemic era some things regarding the European strategy that have to do with our sector. Repatriation of production in Europe. Encouragement of innovation and biopharmaceutical R&D. The new legislation is in the pipeline. It will be passed by the European Parliament, and of course strategic autonomy of healthcare systems of EU countries. Mr. Angelis participates in the Critical Medicines Act, which is very important to know which critical and crucial drugs and raw materials can be produced in Europe to increase our independence and avoid the problems we had during the pandemic. At the national level, at the risk of repeating myself, I must say that underfunding has numbers. 400 million in 2014. The pharmaceutical industry is paying 3 billion in 2024. There's a gap, and part of this could be seen that part of the consumption is a discount. But what we have as a balance is 1.5 billion from the pandemic crisis. Of course, no one is expecting the government to say that they should chip in 1.5 billion, and we wouldn't ask this because it would be utopian on the one hand and the government wouldn't do it on the other. But we need to record this amount. Now, a second observation is that a lot of steps have been made forward over the past few years. There have been steps forward on digitization, regarding HTA, baby steps, of course, but it will change. We have the negotiation committee. There's a lot of punches thrown there, and we cannot react. We can't even put up our defenses. And, of course, the organization and the fact that for the government is very important. There is an understanding. The government has a work team with Mr. Kontogeorgis, the minister, Mr. Angelis, have been analyzing things, but we need to cover very, very fast some of the targets. Investment clawback, a very important thing. It was an opportunity, particularly for Greek companies, to start covering the investment gap. But let's not forget that it's 100 million in 3 billion, out of 3 billion. I mean, it's exceptional. We designed it with the Prime Minister and we analyzed it, we implemented it. What we told the Prime Minister in 2019 became investment, became jobs. But this is not enough. Because what we did was a new unit in Keratea that was 100% operational, and we thank the government that they offset 12.5 million out of 60 due to the funding that we had. The other 47.5 million is own capital, own assets of the company, and unless we had exports, we would become we would be owned by the state with what we owe to the OP. I mean, there are accumulated things, installments, debts, things that need to be regulated as a whole. Well, the environment is difficult. It's a recessionist, I would say. We have a lot of sufficiency and coverage. We have proven so, as well as investments. And at the moment, Greek factories are 12% of the productive power of the EU. We're one of the 5 more important production areas, and we cover more than 40 million Greeks and Europeans with our drugs. The problems, however, are such that need to be covered, and covered fast. First is underfunding. I don't want to say anything else. I mean, we all know what I'm talking about. It's a very positive thing that even after the RRF, the government has committed themselves to find the resources, and the difficulties are great. It is very important for this team under Mr. Kontogeorgis that I think has already set the foundation, built the foundation to further create monitoring, auditing and control tools and collaboration between EOP, EOF, IDIKA and everyone. To talk about the use and consumption of drugs, we have been carrying from the past on-patent and off-patent use, and it's much bigger use than in many other countries per capita. I would not want to talk about the latest problem we saw with the AOP and other similar problems that already exist out there. These need to be resolved and resolved fast. And the entire industry is at the disposal of the government for technical assistance. It's very important in terms of human resources and financial resources to help fast track in the next few years and find solutions, because they will be tormenting us for years to come. I said the huge consumption of on-patent and off-patent. There is iron, ferrum, it's a bivalent one. So it moves from 5 million to 40 million. I mean, what's going on there? I will start selling ferrum as well, and no one will do it. It's been for 3 years and no one did this. So this negotiations committee set some limitations, and we have problems in our response times. But we also want a stable framework of operation, and the industry will be pressured on prices, it will be pressured on sales, it will be pressured on everything, and on the paybacks. I mean, if you had a big spending or a big expenditure in your organization, in a household, what would you do? I mean, if you had two coefficients, some old drugs and some newer drugs, and the old ones, both 2009 to 2010, were reduced by 80%, and their use was not increased, did not increase. The newer drugs, well, of course, we have the benchmark of the EU, what happens with the lowest the lowest prices and everything, and we have a benchmark there, and so on and so forth, and not at the level of an emotional formula, which parallel to measures that need to be undertaken by everyone. These are distortions from the past that need to be resolved in the years to come. We want to contribute to this policy with actions rather than just words. So innovation must be at a rate that we really support these innovative drugs, and to let the patients who need them take them. We have a drug for heart failure. We collect €2 per month net. If someone audits our production cost, you can see what these €2 can cover. It costs the state €4. There's a new treatment, a treatment advantage to 5% of the population for €80. The state pays €40. All these things need to be included in a framework as regarding innovation. Yes to the innovation fund, but we need to see how these things happen and how these things reflect to the population. Yes to off-patent, yes to generics, but where we have absolute prices, not to the €4 and €5 drugs. Let's see what happens to €2. Yes, clearly, to the prescription control. And our companies have a big production footprint in terms of research or production, and we're very proud to be able to cover a great part of the needs of Greek patients. Now, I'll give you some pictures from some of our factories to give a positive sign. Several foreign companies here, so it's very important the footprint that we have here. And this will become even more intense in collaboration with the government. Thank you very much.
I would applaud, but it's like I'm watching a negotiation taking place. In the negotiations, of course, there is no applause. I heard Ms. Barmpetaki describing a model, a completed model, including 5 different chapters, basically. I heard Ms. Chouliara describing what is the position of Greece vis-à-vis Europe, what's going on in Europe and what we are doing here. Something is wrong here. And I'm listening to you, Mr. Tryfon, who talked about the reality of the market. €2, €4, which are then translated to billions. And of course, this is a very difficult exercise to solve. So since we heard all of what you had to say and we saw the presentations, I would like now to turn to Mr. Angelis and conclude with the Minister, because you need to answer. You will choose the points to which you're going to answer. Ms. Angelis, however, I would like to ask you, I know that assessment requires money in order for it to be effective, and I know that you have thought about this because you have found some resources so as to make proper assessment, more professional assessment. How should I put it? They have told me that I shouldn't use slides, otherwise I would have used slides. Basically, You just saw which are the links in Greece. Associations, industry, states. So what they need to do is to agree on the goals and then proceed to the memorandum to which we were referring. This was a preview of the dialogue that you're having before you reach an agreement. I would like to say once again that the agreement has to involve all industry and not specific part of the industry, because otherwise this comprehensiveness of the agreement cannot be reached, and this is absolutely necessary. Now, with regard to assessment, it was mentioned previously, the report by Mario Draghi. The minister mentioned it and Mr. Tryfon, and they said that one of the main conclusions was that more investments are needed, that there has to be reshoring of production, but at the same time there has to be diversification and other partnerships with other countries. So the Critical Medicine Alliance is indeed a very important initiative that is taking place at European level and will lead to the Critical Medicines Act as of next year that will provide financial and non-financial incentives so as to ensure this reshoring of production, starting with critical drugs and then maybe later on innovative drugs. And in order to go back to the conclusions by Mario Draghi, the one was mentioned by Mr. Tryfon. The other conclusion pertains to health technologies. In order to resolve the distortions of the system and to increase effectiveness, we need to have proper assessment. What is the technology used for that? Health technology assessment. What is Greece doing? In collaboration with DG Reform of the European Commission and the WHO, started in August, basically, a project, the so-called technical support instrument, in order to receive technical assistance and assess the framework as it is in Greece, because we should not forget that we have a new regulation that will be implemented as of January 2025, and we need to be ready to cooperate with other member states in order to ensure assessment at central level. Now, the assessment before new drugs arrive in the target is done by EMA, and the same will stand for these drugs. It will be done by in collaboration with other member states, so that we can have these additional assessments before we proceed to production. So this was a very important pillar. All the speakers talked about its importance, and we are all here in order to keep up with the European developments and to be leaders in the joint submissions that the industry is going to make in all the countries. All of you talked about predictability. This is a new term used in the health sector. At least this is what I think. In the past, this word was not that used. Predictability can actually make a difference, as you said, since we're talking about difficult problems that we are faced with the cost of billions. So this is something that everyone wants. So the only question that emerges is, how feasible is it? How quickly can we expect to get predictability as a result of this dialogue? Yes, I would like to add one more word, because, okay, we are having a technopolitical discussion now that we are all gathered and all the friends are listening to us. And I said what I said at the beginning, but now, after hearing the panelists, I would like to add another term. History. We know that we have gone through difficult times and crises, and in the past we had the compulsory commitment of the state to do specific things during the memoranda. Now we are in a time of self-commitment. What does this mean? We need to make our own choices, national ownership, and of course this was depicted in the RRF, where what did we say? You Europeans make suggestions. Okay, we understand our pathogenicities. We want to do that. And we made some self-commitments that will be valid even after the end of the mandate of this government. But in order for this to actually materialize and to avoid discussing the same all over again, all these framework agreements that we are talking about, be it at European or national level, need to be defined by some historic information, which means we wouldn't be here talking about this agreement, and this agreement will not be materialized unless normality had prevailed in the country once again, unless an investment environment like the one we have now was created. And the issues that we are talking about did not emerge in 2023 or 2019 or 2015 when we defaulted as a country, nor in 2010 when we entered this financial adjustment program. Of course, there were some developments that influenced our trajectory up to now, but things in the past were not ideal. And when Greece actually signed this memorandum, and we will see what form this memorandum will take, meant that this government that represents the Greek state has taken the responsibility. And actually, this is what I'm saying based on what I've heard before. The responsibilities of the administration, which is actually responsibility of politics, since we were not able to measure, we were not able to audit, we were not able to prevent mistakes. But you know that not only the state, but all other parties take the responsibility for a joint action in the future. So since we are having this line that is influenced by the historic background, by the past, we need to find a way in order to find an exit out of this vicious cycle between private and public, because now is the moment, now is the opportunity to make the most of the normality that has prevailed, and in order to make the necessary changes, because our rationale is to be more useful and less pleasant. And history has shown that the most useful were not that pleasant. So what we are going to do, and on which we need to agree, will not be pleasant for everyone. However, they will be important, and they will incorporate this historicity for action and for joint action. So this will be depicted not only in the way that we are going to monitor, we are going to integrate proposals made by the market pertaining to the rationalization of the channels, the auditing mechanisms, and how the central government will monitor this, but also the funding. But the responsibility will be joint responsibility vis-à-vis the policies, the practices, and the way we move forward, because the objective must be one: the strengthening of the public health system, and of course the surplus of growth that can stem from innovation and new drugs and so on and so forth. So I'm very optimistic because systematic work has been done. Aris, that has taken part in the committee, has experienced it. Many of you also know that there is a far better understanding of the matter, and now also in the Ministry of Health there is a leadership that understands the matter, has the will to proceed to changes. We promote these changes, and we will be here to be judged for our actions. Okay. We need to conclude this discussion because we are lagging behind 10 minutes. However, it was absolutely rational what we heard. We also saw very interesting presentations. But before I thank you for your attention, I would like to ask you half a question. We have the cooperation between Ministry of Health and Ministry of Economy. So what is the time frame for all this to happen in your view? We have talked about that in the context of the Delphi Forum, so my answer will be very, very quickly. I believe that all the interested parties know that we are very close to our objective. Of course, many things need to be depicted, but the basic axis of what we want to achieve, the degree of involvement of the government and of the political leadership that will define the future. I mentioned the ministries and all the other agencies. I believe that all these have done excellent work and will be evident very, very quickly.